Hello everyone, I'm an MR Clinical Application Specialist of Lonwin Medical System. Today, we are going to talk about the most important aspect in MRI, that's MRI safety. We make this presentation to promote safety in the MRI environment. We hope you find it useful in training staff at your site. And also, there are some safety suggestions maybe you have heard of before. First of all, we need to know some potential risks in the MRI environment. MRI procedures have been used for over 30 years. This modality is considered relatively safe and holds great promise. However, MRI has a number of risks, and all the risks have been broadly divided into two categories: physical risks and psychological risks. Here you can see some of the physical risks, including the projectile or missile effect, radio frequency bioeffect, electrical burns, auditory damage, peripheral nerve stimulation, anaphylactic reaction to contrast agent, neurophorogenic systematic fibrosis, NSF. Psychological risks including claustrophobia, fear, panic, anxiety. Because of the importance and potential risks of MRI safety has been widely concerned. Many authoritative institutions, such as the SMRT Safety Committee, FDA's Center for Devices and Radiological Health, MHRA, regulating medicines and medical devices, have attached great importance to MRI safety issues. These institutions highlight MRI safety in their official websites. As stated on the official website of SMRT, MR safety education is necessary for all staff, including technologists, radiographers, and MR operators. The international and national guidelines had been published to provide relevant safety information for users of MR equipment in clinical use. The guidance is intended to reflect current risks and hazards and to ensure safe practice by our MRI safety training. The aim of this presentation is to provide a basic overview of key aspects of MRI safety. We'll first provide a brief description of MRI and the MRI environment, then highlight MRI safety risks and go on to provide information about key steps required to promote safety in the MRI environment at the end. At the end of this presentation, all staff accessing the MRI environment will be able to describe the MRI system, describe key MRI safety issues, understand the importance of MRI safety screening, and describe the MRI safety screening process. Finally, all staff will have an understanding of emergency situations that could be potentially arisen in the MRI environment. So, what is MRI? MRI stands for Magnetic Resonance Imaging. It is a unique imaging modality that uses a strong magnet and radio frequency magnetic fields to produce detailed images of the human body. Does not involve ionizing radiation such as X-rays. And there are no known side effects of having an MRI examination if safety practices are followed. During the performance of an MRI procedure, the patient is exposed to three forms of electromagnetism: a powerful static magnetic field, changing magnetic field, and radio frequency field. These electromagnetic fields are essential to the operation of the MRI system and are active together during the imaging procedure. Using the unique physical properties of electromagnetic fields, along with advanced computer technology, images of virtually any part of the body may be obtained. Then we'll talk about the MRI environment. MRI departments are similarly designed to restrict access to the strong static magnetic field. This is to prevent untrained, unscrewed personnel or members of the public from entering the MRI scanner room and coming into contact with the strong static magnetic field. There are a number of guidelines around the world about restricting access in MRI departments, but all these procedures have the same objective, which is to ensure safety in the MRI environment at all times. One approach widely adopted to restrict access to the static magnetic field of the MRI scanner is the 4-zone design recommended by the American College of Radiologists. In this design, Zone 1, for example, is the lobby or reception area, which allows public access with no specific restrictions. Zone 2, for example, the changing rooms and the screening areas, is not public access. Zone 3, the MRI control area, and Zone 4, the MRI scanner room, are restricted access where persons must be screened and supervised by trained MRI personnel. Here is an example of an MRI suite where Zone 1 is the reception area, an entry into the MRI suite. Zone 2 encompasses the changing inpatient screening areas. Zone 3 contains the MRI control area and entry into Zone 4. Zone 4 is the MRI scan room itself. This departmental design reduces the chances of individuals accidentally entering the MRI scanner room because a person must pass through the supervised and restricted zones before coming in contact with the static magnetic field of the MRI scanner. So, we have learned the MRI environment. Let's talk about why we restrict access and explore some risks encountered in MRI. You may be wondering, how powerful is the magnetic used for an MRI system? The strength of a magnetic field is indicated in units of Tesla. Your refrigerator magnet has a magnetic field of less than 0.01 Tesla. Magnets that are used to pick up junk cars may have a magnetic field strength of about 1 Tesla. The magnetic field of the Earth, which is responsible for making a compass needle point north, is very small. By comparison, the magnetic field strength of a typical MRI system, which is measured at 1.5 or 3 Tesla, is 30 to 60,000 times more powerful than the magnetic field of the Earth. Again, it is important to remember that the magnetic field of the MRI system is always on, 24 hours a day, 7 days a week, 365 days a year, even when a patient is not being imaged. If you enter the room where the scanner is located, you will be exposed to the magnetic field. Accidents often happen because people assume that the magnetic field of the scanner is off and mistakenly bring inappropriate metallic objects into the room. The powerful magnetic field of the scanner can attract certain metallic objects, causing them to move suddenly and with great force towards the center of the MRI system. This is referred to as the projectile or missile effect. Obviously, the missile effect can pose a substantial hazard to the patient inside of the scanner or to anyone in the path of the flying projectile. The missile effect is the most critical safety issue for non-MRI personnel entering the MRI environment. Here is an example of the missile effect, showing the magnet of the MRI system attracting a metallic wrench. The brick shattered when it was hit by the flying wrench. This clearly illustrates the potential hazards of bringing metallic objects into the MRI environment. Accidents involving metallic projectiles have caused injury and even death in MRI. Environment accidents involving small or large objects such as infusion pump, oxygen cylinder, and patient bed, which can damage equipment and injure people. Here are just a few examples of large objects being easily drawn into the MRI scanner. Such accidents are often a result of improper supervision of non-MRI safety trained individuals or improper training of the staff working in the MRI environment. Unfortunately, sometimes these accidents can be fatal. This was the case when a 6-year-old boy was hit by an oxygen cylinder during an MRI examination. The boy was having a routine scan under sedation, and before the exam began, the anesthesiologist observed a decline in the boy's oxygen saturation levels. So he turned to approach the boy with an oxygen tank. When the magnetic attractive force pulled the oxygen tank from the doctor's hand to the center of the scanner, where it struck the boy in the head, causing fatal injuries. Safety risks also exist within the radio frequency magnetic field. So what's the radio frequency magnetic field? Or what's the function of radio frequency? Brief to say, the radio frequency pulses are used to create the MRI signal. Radio frequency energy is transmitted from the transmit RF coil inside the MRI scanner to the patient, and then a receive coil, which is positioned around the patient's body, is used to detect signals from the patient. Throughout the procedure, the patient has much energy absorption, and at the same time, energy release is going on. The potential risks happen when energy absorption exceeds energy release. It means that the excessive energy can be deposited in the body. Sometimes it can cause excessive heating, which results in severe tissue damage. Here is an example of an MRI radiofrequency thermal burn where amputation was required. This 5-week-old girl received 4th-degree burns when a pulse monitor was used during her scan. That was not safe for use in the MRI room. A current was induced in the loop of wire around the girl's wrist, and that heat energy was concentrated on her wrist during the 40-minute MRI scan. This is another important reference example of a radio frequency burn in MRI. This person was questioned prior to MRI whether he had any devices or implants inside of him. He had in the past had an implanted deep brain stimulation, but the generator box had since been removed as far as the patient was concerned. The whole system had been removed. So he answered no to having such a device in sight and went on to MRI. Unfortunately, the transmitting leads were still inside of him, and for the duration of his scan, the leads were within the radio frequency field. During the scan, heat energy was transmitted along the length of the transmitting wires and resulted in radio frequency burns in his brain. The MRI operators noticed he wasn't behaving the same as prior to his scan, and he was sent to head CT, which revealed the implanted wires and corresponding tissue damage adjacent to the tips of the wires. So, from this example, we have learned that instead of asking a patient that do you have a device or implant inside of you, it's better to ask that, have you ever had an implant or device inside of you? Such a simple turn of phrase can make a big difference in MRI safety scanning. So, to summarize, there are two main safety risks of metal in MRI. We need to be aware of the projectile or missile effect, where ferrous metallic objects are implants. They can be strongly drawn towards the magnetic bore. The other is the potential heating of magnetic objects or devices due to the exposure to the radio frequency magnetic field, where non-ferrous metal objects and implants are not attracted to magnets. They are still a safety risk for heating. The third magnetic field used in MRI is the gradient magnetic field. Gradient coils of the MR system produce gradient magnetic fields that are spatially vary in strength across the patient to help localize the signal for image information. There are 3 sets of gradient coils, one for each direction. Gradient magnetic field effectively provide coordinates the signal received from each point in the imaging volume. I don't know whether you guys have performed an MRI examination. If you have, you undoubtedly heard a series of acoustic noise. These noise that sound like dee 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 da da or come from the gradient magnetic fields. So, the acoustic noise levels in MRI are considered a safety risk. The sounds while scanning are caused by interactions between the static magnetic field and the gradient magnetic fields. The sounds vary between MRI sequences, and sound levels in MRI may routinely rise above 85 decibels. This is an important safety concern because prolonged exposure to such sound levels has been shown to cause hearing loss. MRI staff must prevent hearing damage caused by exposure to the acoustic noise of the MRI scanner. All persons remaining in the scanner room during scanning must be protected from hearing loss with appropriate hearing protection fitted correctly. Such hearing protection includes headphones or earplugs. Remember to provide instructions for appropriate use and only use hearing protection with the proper rating. This graph of MRI sequences shows an example of noise levels in decibels recorded on a 1.5 Tesla MRI system. These are recordings of actual MRI pictures being taken. As you can see from the graph, all the recording were above 85 decibels, which is a concern for hearing loss. It's also important to note that sensitivity to noise varies between individuals and may be influenced by a person's age, health status, or even medications. Peripheral nerve stimulation is another risk of MRI resulting from time-varying fields such as the gradient magnetic field. It should be noted that peripheral nerve stimulation gradually results in discomfort rather than long-term injury. Currents can be induced in a patient's peripheral nerve fibers, possibly causing sensations of pressure or pain, or may result in twitching sensations. This can be quite uncomfortable for the patient. The degree of sensation is dependent on the sensitivity of the patient, their positioning, and the types of images being required. Another safety risk in MRI is associated with MRI contrast agents. Gadolinium, commonly referred to GAD or gadolinium. GAD is a ferromagnetic contrast agent that's used to improve the visualizations of anatomy or to highlight pathological lesions or disease processes. It's administered intravenously where the dose is based on a patient's body weight. Gadolinium is contraindicated in pregnant patients, patients with poor renal functions, and those who have had a prior allergic reaction to GAD. MRI contrast is generally considered safe, but as with any injection, complications are possible. The incidence of allergic reaction is very low, but it does happen. GAD is normally excreted from the body by the kidneys, but there is concern that GAD is not excreted normally in some patients, leading to retention of GAD in the body, particularly in bone and brain tissue. If a patient's renal function is impaired, there is also a risk of developing serious complications such as neurogenic systematic fibrosis, as shown in the graph. Renal function should always be checked prior to MRI, and careful consideration should always be made prior to administering a contrast agent. Now we'll move on to how we ensure safe practice in MRI. There are a number of key steps we can all do to promote safety in MRI. The first key step, which is also the most important step, is establishing MRI safety of implants and devices. There are 3 MRI safety categories in MRI safety labeling: MR safe, MR conditional, and MR unsafe. MR safe items pose no known hazards in all MRI environments, whereas MRI conditional items have specific conditions that must be met for safe use in MRI. MRI unsafe items should never be taken into the MRI scanner room. They are not safe in any MRI environment. These are examples of standard MR safety symbols used in labeling devices, implants, and equipment. First of all, we need to learn which items are MR unsafe. Here we list MR unsafe implants and devices which should never be taken into the MRI scanner room. The pacemakers, cardiac defibrillators, medication pumps, and nerve stimulators can be affected by the static magnetic field, which can be life-threatening for patients. For the patient with the aneurysm clips or metallic foreign objects, we need a document that proves they are MR safe. Otherwise, the patients can't be allowed to enter the MR scanner room. MRI absolute contraindications mean contraindications for which there are no reasonable circumstances for performing the MR examinations. Patients within all these MR unsafe items can be regarded as MRI absolute contraindications. We collected this information from the website of MRI Safety as comprehensively as possible, and this information is quite important for all MRI staff. Patients with absolute contraindications should not be examined. Here are some photographs of MR unsafe items we often see during clinical use, such as pacemakers, ferromagnetic aneurysm clips, cochlear implant, nerve stimulator devices, and metallic foreign bodies in body. The conditional information for implants and devices can be found in the manufacturer's product information sheet or instructions. Review the MR conditions for safe use. Be aware that there may be a field strength restrictions and scanning limitations. It is important to note that even if an implant or device is labeled MR conditional, it may still cause artifacts in the images. Here are examples of MR conditional implants and devices. Here we can see the endovascular stent grafts, intrauterine contraceptive devices, tattoo, joint replacement, inferior vena cava filter, and so on. When patients have these MR conditional implants or devices in their body, we should carefully consider whether to perform the MR examination for them. Also, there are some items that can be taken into the scanner room if marked properly with an MRI safe sticker. For example, if you're assisting a non-ambulatory patient into the MRI system room, make sure the patient is using a non-magnetic wheelchair or is on a non-magnetic gurney. Inspecting the wheelchair or gurney for the presence of the magnetic oxygen tank, IV pole, or similar components or accessories before allowing the patient into the MRI system room. Fortunately, there are many commercially available devices including wheelchairs, gurneys, IV poles, oxygen tanks, and maintenance that are made from non-magnetic or non-metallic materials that may all be used safely in the MRI environment. The second key step for promoting safety in the MRI is appropriate screening of persons before they enter the MRI control room and MRI scanner room. MRI screening procedures are important in protecting individuals from MRI system-related accidents and injuries. The majority of MRI-related incidents have been due to failing in the screening process or lack of properly controlling access to the MRI scanner. Screening involves the use of a written form and verbal interview to identify items that may pose safety or other problems. Part of the screening procedure is to identify items that are not allowed into the MRI system room. These items include things such as external metallic objects and internal implants. During the screening procedure, the patient will be asked several important questions. These questions include if you have had any prior surgery, if you have metallic implant, or if there are any metallic fragments in your body. Even the smallest piece of metal, such as a foreign body embedded in your eye, could cause a problem if you get too close to the system's magnet, and this could result in a serious injury. Women will be asked if they are pregnant or if they suspect that they are pregnant. Other questions will be posed to you to determine if you have specific implants and devices. They could be hazardous to you if you go into the MRI system room. For example, individuals with cardiac pacemakers, implanted cardioverter defibrillators, ICD, or any other magnetically or metallically activated devices are not allowed into the MRI environment. MRI safety screening forms, such as this one pictured here, are used for screening individuals. These forms contain information about a patient's health and a checklist of devices, implants, or surgeries to help establish if an individual has had a medical procedure that may involve a device or implant. The MRI screening form also contains a section designed to assess risk for patients requiring MRI contrast agents. This section includes questions about kidney function and helps establish any risk or reaction to the contrast agent. The MRI screening form also includes space for the patient's date of birth, height, and weight, which are mandatory for safe scanner operation. In general, there is no known risk of using MRI in pregnant patients. However, MRI is reserved for use in pregnant patients only to address very important problems or suspected abnormalities. In any case, MRI is safer for the fetus than imaging with X-rays or computed tomography. It is recommended that pregnant patients should be informed that the safety of MR during pregnancy has not been proved. Before entering the MRI system room, the patient must remove all metallic belongings, including wallets, cards, watches, pocket knives, and jewelry. Besides being attracted to the magnetic field of the MRI system, Objects such as cell phones, hearing aids, and beepers may be damaged. Therefore, these objects are not permitted into the MRI environment. Any equipment to be used in the MRI scanner room must be MRI safe or MRI conditional, and all equipment must be appropriately assessed prior to use in the scanner room. So, how can we determine if items are ferrous? Ferrous metal detectors or test magnets may help indicate whether equipment is ferromagnetic, just like these. Remember to adequately prepare patients for their scan. They must be MRI safety screened, changed out of street clothes into appropriate hospital or clinical clothes free of metallic parts, and the MRI procedure explained to them in a manner that they understand. The third key step to promoting safety in MRI is performing risk assessments for appropriate use. MRI staff must protect patients in the MRI scanner by preventing radiofrequency burns induced by loops in cables or leads. Loops in cables or leads must not be allowed to form within the magnetic bore. All cables and leads should exert the magnet for direct out from the patient without forming loops or touching the patient. Here are some examples of incorrect placement of receive coil. Note how a loop is formed around the patient and see how the coil leads are entangled. Do not allow loops like this to form inside the MRI scanner. It's quite dangerous for the patients as well as the coil itself. Insulation pads can be used to help prevent radiofrequency burns to patients in MRI. Sponge pads separate and insulate patients from direct contact with leads, coils, or the scanner bore. These pads can be placed between the arms and legs of patients to prevent skin-to-skin contact points forming potential circuits for conducting heat energy from touching body parts. Here is a real-life example of the correct placement of leads exiting the scanner for a patient in MRI. Note the pads placed between the patient's arms, preventing the patient's skin directly contacting the walls of the scanner bore, and the large insulation pad preventing the cable touching the patient's leg. The final step to promote MRI safety that we will discuss is to ensure that you have established protocols for MRI emergencies. Medical emergencies can occur in MRI. Ideally, a medical emergency response should never be conducted in the MRI scanner room. It's human nature to rush in to help, and people may inadvertently bring in medical items which are projectile hazards within the static magnetic field. For example, a wheelchair, defibrillator, or oxygen cylinder. You may remember this is what happened in the fatal case involving the young boy that we discussed earlier in this presentation. As mentioned before, a superconducting magnet is always on, but an emergency situation may arise where the static magnetic field of the scanner needs to be turned off. This is referred to as a quench. Quenching the magnet causes a rapid release of helium gas, which results in a loss of the static magnetic field. A quench also can happen accidentally. For example, due to prolonged power failure. It can also happen deliberately in an emergency situation by activating the quench button. During a quench, the liquid helium rapidly boils off and becomes a gas. Helium gas vents outside of the building via the quench pipe, which is usually at the top of the scanner. You should beware, however, if the quench pipe fails, there may be a buildup of gas and pressure in the MRI scanner room. Risks of faulty quench pipe during a quench includes asphyxiation due to a decrease in the available oxygen in the room, frostbite due to the extremely cold temperatures of helium. Another important consideration is the damage to the MRI system and associated costs of repair, as it can often take some weeks or even months to repair an MRI system after a quench. In the event of a quench, it is important to do the following. Open the scanner door, evacuate the MRI scanner room as quickly as possible. Do not close the scanner room door until the MRI scanner room has been fully evacuated. Then contact the manufacturer in time. Besides these medical emergencies mentioned above, there are still some other medical issues the MRI staff may encounter. What if a patient has an unknown implant? MR staff must clear the patient in writing before starting the examination and should not perform the scan until the risk of the unknown implant is determined. What if a patient complains of burns? Well, when hearing the complaints, MRI staff must stop scanning immediately and take the patient out of the room and investigate further. To conclude this presentation, we will now summarize MRI safety issues that all staff should be familiar with. To promote safety in the MRI environment, all staff need to understand the following. 1. The key aspects of the MRI system and MRI environment. 2. The very rare MRI safety issues and risks. 3. Staff also need to understand the importance of MRI screening and how to undertake the MRI screening process. Finally, all personnel need to be aware of and adhere to policies and procedures that provide guidelines for emergency situations that can potentially arise in the MRI environment. Just remember this mnemonic: MRI equals metal results in injury. Thank you for participating in this MRI safety training. If you require additional information, please visit our website.